I've been in surgery for 20 years, and I have never worked with anybody that is so precise.
I said he's the greatest thing on since sliced bread, and in fact I gave a lady a card the other day. Go see Dr. Rock. You have everything done? Go see Doc Rock.
If I'm looking for a relaxing day where I don't have to dwell on much, I look forward to Monday all day in the operating room doing knee replacement, hip replacement, one after another. We've done so many that it becomes very patterned. It's like a symphony.
Dr. Neal Rockowitz, who graduated from MIT and the prestigious McGill Medical School in Montreal, is a board-certified, fellowship-trained orthopedic surgeon and has called the Valley home since 1989. He is one of the top joint replacement surgeons in the country.
I think my credentials as far as training goes speak for itself. I went to great institutions. I was trained by world-class surgeons. And it's my job is to bring that to the patient. And I think you just need to be friendly and empathetic and confident.
Speaking of confidence, in a medical community where most orthopedic surgeons are affiliated with a group, Dr. Rockowitz, also known as Doc Rock, built a solo practice that has thrived in the Valley for over 2 decades and is put together with a clear purpose. From its energy-efficient building and the Got Rock charity campaign, to the office, which is also a photography gallery.
There are works, photography here, that people come and pick up and they put in auctions for either charity auctions or raffles or any other kind of fundraising.
Doc Rock was the first surgeon in Arizona to perform the direct anterior hip replacement. A recent study has shown that if this highly demanded technique is done by surgeons without special training and extensive experience, the complication rate is enormous. Dr. Rockowitz is so well versed in this complex procedure that the Johnson & Johnson company asked him to help create a new total hip replacement implant, the Tri-Lock Bone Preservation System, which is the perfect match for the anterior approach.
Most surgeons in the country go through the back, and it's radically different for them. But for me, it was already close to what we were doing. So I had an interest, and immediately I gravitated to the idea that, this could be a game changer. I think it takes the pain level after a hip replacement from 100% to 10%. It takes the use of walking aids for 6 weeks from 100% to almost nothing. The restrictions after hip replacement are abolished.
So much easier. You're out of the hospital 1 day sooner. You're up and running 1 day sooner. You don't have you have to do the therapy, but then that goes along with any of them. And it's just easier all the way around.
He released me at 6 weeks, and my first time out golfing, he says, I want you to take it very easy, and I want you to do anything crazy, but go out and play, and just make sure you don't put yourself in any awkward position. So my first time out, 7th hole, on my first time out, I'm playing on my new hip, I got a hole in one.
Now, Doc Rock can't guarantee everyone a hole-in-one after surgery, but golf or not, he can give you more playing time on or off the course. Not only does he treat older arthritic patients, but also younger patients who may be dealing with sports injuries and are in need of minimally invasive arthroscopic surgery.
So we're getting their disease at the infancy, and we get them back on the playing field, but eventually those knees become arthritic, and we get to follow those people over decades.
So whether you're in need of 1 joint replacement or up to 10 like Ed and Leona, Doc Rock has you covered.
We knew right away, if we have anything done, we'll be here.
You take somebody who can't walk, and literally hours later, they can move their hip painlessly, they can walk painlessly. I can't think of another procedure in all of medicine that gets such immediate gratification for a patient.